If you're a woman over 60, there are a few things your doctor wishes you knew, but may never have told you out loud. And no, it's not just about eating more greens or taking your vitamins. These are the quiet truths, the gentle warnings, and the life-saving clues that often get missed in rushed appointments and short conversations. So lean in, because what you're about to hear might just help you stay healthier, sharper, and stronger through your 60s, 70s, and beyond. Let's begin with this. Your body speaks before it screams. One of the first things doctors learn is this. The body whispers before it shouts. That knee pain you've been brushing off. That brain fog that feels like just getting older. That tightness in your chest you felt just once. These aren't just quirks of age. They're clues, early signs, gentle nudges from your body telling you something's changing and asking for your attention. But here's the secret. Most women don't mention these symptoms until they've become serious. Why? Because we're taught to push through, to be polite, to not make a fuss. But your doctor, she wants you to fuss, to speak up early. Because when you do, there's still time to do something about it. Coming up, 5 quiet signals doctors wish every woman over 60 would take seriously before they become something bigger. And no, it's not just about cholesterol or blood pressure. Some of these are things no one warns you about. Number 1, you're more tired than usual, and it's not going away. You wake up tired, you feel sluggish by midday, and you've started calling it normal for your age. But your doctor sees something different. Persistent fatigue can be a sign of something deeper, like low iron, sleep apnea, undiagnosed thyroid issues, or even early-stage heart failure, which can present differently in women than in men. Your body might be trying to conserve energy because it's not working efficiently behind the scenes. If that tiredness doesn't go away with rest, if it lingers or starts to affect your mood or memory, you need to bring it up. Not because it's scary, but because it's fixable. The sooner you bring your energy concerns into the light, the more options you have to feel better. Number 2, you've stopped doing little things, but you're not sure why. You used to pop to the store. Now you'd rather sit. You used to garden. Now the tools stay in the shed. And when people ask, you say, "I'm just not as young as I used to be." But in medicine, we call this a red flag. Specifically, functional withdrawal. It can be physical, emotional, or neurological, but it almost always means something's going on beneath the surface. Sometimes it's joint pain, sometimes it's anxiety, sometimes it's early cognitive decline. The problem is, this kind of slow withdrawal is so subtle. Even your family might not notice. Even you might not notice until it becomes your new normal. But your doctor notices, and she wants you to speak up before that normal becomes permanent. Number 3, your balance feels just a little off. Not enough to fall, just enough to feel unsure. Maybe when you get dressed, maybe when you bend over to reach the bottom shelf, or maybe when you walk on uneven ground and suddenly feel more cautious than you used to. This is what doctors call early proprioceptive loss, a fancy word for the brain and body slowly losing their spatial awareness. And it matters, because your sense of balance is deeply connected to your nervous system, your ears, your muscles, even your eyes. It's one of the earliest signs that your coordination and strength might be declining, long before you're technically frail. And here's the best part. You can train balance, you can strengthen it. There are specific exercises, some you can even do while brushing your teeth, that can reduce your fall risk and restore confidence in your body, but only if you recognize the signal before it gets louder. Number 4, you're not sleeping, and it doesn't make sense. You go to bed on time. You've cut back on coffee. You even read a book instead of watching TV before bed. But still, your sleep feels broken. You wake in the middle of the night. You lie awake for hours. You wake up feeling like you haven't rested at all. This isn't just frustrating, it's important. Poor sleep after 60 affects everything. Your blood sugar, your weight, your immune system, your memory. It also raises your risk of heart disease and cognitive decline, even if the disruption seems mild. Sleep is when your brain clears waste, your muscles repair, and your hormones reset. And yes, sleep changes as we age. But it's not supposed to disappear, and waking up 5 times a night isn't something to ignore. Sometimes it's as simple as magnesium or a low vitamin D level. Sometimes it's hormone-related. Sometimes it's something more serious, like undiagnosed sleep apnea, which affects more women than you'd think. But your doctor wants you to bring it up, even if it feels minor. Because your sleep isn't just a luxury, it's a form of medicine. Number 5, you've started withdrawing from people you love. This one is hard to talk about, but it's real. You find yourself turning down invitations, not calling people back, spending more time alone, and not always because you enjoy it. And maybe you've told yourself you're just slowing down. But your doctor may see the early signs of something deeper. Sometimes this is a symptom of depression. Sometimes it's the earliest warning of cognitive changes. Sometimes it's burnout after a lifetime of giving to others and never being poured into. Whatever the reason, isolation after 60 is dangerous. It's not just emotional. It increases your risk of stroke, dementia, and even death, at the same rate as smoking 15 cigarettes a day. Connection doesn't have to mean constant socializing, but it does mean staying plugged in, with someone, somewhere. Even one phone call, one cup of tea with a friend, one laugh. Because connection isn't just comfort, it's a protective factor for your mind and your body. So don't dismiss it if you find yourself pulling away. You've just heard 5 quiet things your body and your doctor want you to notice. You don't need to panic, but you do need to pay attention. Because the earlier you notice these shifts, the more tools you have to support yourself. Your doctor isn't just there for emergencies. She's there to help you stay well. And so am I. You deserve to age with clarity, calm, and confidence. So if any of these signs felt familiar, don't brush them off. Don't push them down. You've spent your life caring for others. Now it's time to care for you. If this video helped you feel more informed, or even just more seen, please give it a like. Share it with another wise woman in your life. And subscribe to Senior Health for Women for weekly advice that's calm, clear, and grounded in both science and compassion. Until next time, listen to your body and treat it like it matters, because it does.